And I really wanted to avoid the question of SHA, but you have mentioned it a couple of times. The president today has spoken about the fact that SHA is working. I don't know whether that's the report that you're giving him and whether this report resonates to what it is that is on the ground. That today we really are seeing patients going home simply because they cannot afford the full 1 year payment of SHA. My own mother sent me actually not sent a message before she even knew that I'll talk to you. She was like, well, this 1 year thing, you know, sometimes you pay for different people who are actually not working. How are we going to make sure that we keep this money until we make an annual payment? You know, most of us, you know, are hand-to-mouth kind of people. So when you get your 300 bob, your 500 bob, you want to remit it almost immediately. When you're trying to remit, you're told you cannot do that. You need to do this annually. How do we ensure that, you know, the patients do not end up suffering at home and that every other Kenyan, regardless of their levels of cadres, or, you know, are met, the concerns are met?
Thank you for that question. And I want to confirm to you, SHA is working.
Okay.
And if we have to go granular, we need to go to specifics. That so-and-so went to this facility, the facility's name is this one, and this is the experience. Secondly, we listened to the pain of Kenyans. Even that 1 month paying, some people could not afford. And that is why we introduced the SHA, Lipa SHA Pole Pole.
Okay.
Many patients would go to hospital. Maybe you're from Mjengo or Mama Mboga. You know your money comes on a daily basis, depending on the sales. So they would go to hospital. You are admitted first month. You had paid for just that 1 month, but you exceed the number of days you expected to be there. Maybe you stay for 2 or 3 other months. By the time you're released from the hospital, you have a bill. Because one, your SHA is not updated at that particular time, and you're still in hospital. So you start to kuchanga, you know. So that has really given us a push to help the patients, to help the citizens, to be able to pay their annual pay pole pole.
Is this practical?
And this is,
are they well aware about it?
It is very practical. Probably we may not have given the enough information of how it should be, and that is the sensitization that we are doing. And that's why I'm here today, to also explain to Kenyans what this Lipa SHA Pole Pole is. That if you cannot pay your 3,600 at once, then the government has given you somewhere to get some money from Hustler Fund, the 3,600, so that you can start paying monthly depending on your ability.
Why must it be coined with Hustler Fund?
I mean, it is just one of the sources.
Okay.
We could be having many others that are coming on board. In fact, we've already approached many other financial financiers who can be able to also offer their products in the SHA. So if you feel that you want to get the money from a certain bank, which will be in that in that line, then you can either pick from Hustler or any other.
So this is going to be a loan?
No, it's not
because
alone.
What is Hustler?
It is not alone.
Okay.
This one is not alone.
Okay.
This one is interest-free.
Interest-free?
Yes.
Okay.
You know, Hustler Fund and SHA are two different things.
Yes.
Okay?
Yes.
It is only that Hustler Fund has money which can
help you fund
people who, so that they are able to pay for the whole year. All right? And it is interest-free.
Okay.
Nobody is going to tell you to pay one more coin above what you.
So what are you telling this Kenyan who says, I can always afford to get my 300 bob every month and pay it comfortably? What are you telling them? It must be an annual affair?
What I am telling them is that the money,
to the Hustler Fund?
You can go to Hustler Fund, you can be given that money.
One time?
And then you'll be paying the 300 the way you wanted to be paying per month.
Okay.
But you'll now be returning the money that you have been given.
What does this
It's
do
as
to
easy
the old
as that.
mama who is in the Bundus who is just worried about their condition and must always make these payments for SHA? What happens to them? Because you see, we're talking about universal health care.
Yes.
I don't know whether you people have factored in the importance of this. I mean, to this old woman who has always known that my style of payment is this, it's this, is this, is this. How do you religiously get them off that space?
You see, if even me and you, if you're able to pay for a whole month or for a whole year, and you don't have a problem, remember, you're not actually just paying for yourself. You're paying for you and your family.
That's true.
Because SHA is covering for you. If you're a man and you're the one who is paying, then put your dependents plus your wife. Okay? And if you're a lady, then you will put your husband plus your children. So again, this is a matter of sensitization, which is now upon us, to go down and really explain to the public why this is very important.
And very critical. Yeah?
Very critical for
yes,
them.
It's very important.
Because you do not want to receive calls on your phone from your mom, as you have told me, because probably her SHA is not updated for that 1 month, okay? But if you are able to cover for the whole year, and this time the government is telling you, here is the money.
Okay.
We will give you that money that you don't have. Okay. And you can be paying that 1 month to return that money that you did not have.
What difference, Mheshimiwa, if I'm going to just remit my payments on SHA?
My dear.
And, you know, because if I'm going to take it from Hustler, and then every month I'll have to be making the payments, it's the same thing as just paying.
Those are two different institutions.
Okay.
And this is insurance. You know, the stability of SHA is dependent on me and you.
That's true.
Okay?
So if the money is
remitted, if you
yes.
do not pay, how will we do the capitation for the facilities?
Fair enough.
And the primary health care, which is free for you
all right.
and me
Some civic
and
education.
my mother.